Assalamu alaikum. Welcome to the lectures of the clinical toxicology course for fifth year student, and I'm going to start with an introduction to the subject of clinical toxicology. As you know from the general toxicology course last year, toxicology as a science includes many disciplines. One of them is clinical toxicology. This subject is concerned with the diseases or disorders induced due to short or long-term exposure to toxic insults. They're mostly involved due to drugs or toxic chemicals. So this subject is, as I said, concerned with the diseases and illnesses associated with either short-term exposure or long-term exposure to the toxic chemicals, whether these chemicals are drugs or any chemical substances present in the generally speaking, there are many sources of toxic insults that may harm the human health, and these include first, gas disasters, where natural disasters lead to production of toxic gases, like for example in cases of volcanic eruption, industrial accidents like fire, chemical release from chemical warfare, or an intentional homicidal or genocidal attempts. Second source is from food disasters, where epidemic, like for example in cases of epidemic ergotism, where the weeds contaminated with fungus that produce ergot derivatives that are toxic to human, where mass epidemic of methyl mercury poisoning that occurred in Iraq in 1971, where contaminated weeds are used as a food contaminated with methyl mercury, lead to massive epidemic poisoning with mercury. The third source is the pharmaceutical agent disaster, and a good example for that is the thalidomide disaster occurred in England, which led to the withdrawal of this compound from the market. The fourth source is related to occupational related chemical diseases, where many disorder or diseases occur due to exposure to chemicals and the site where the workers work. For example, used in matching industry, in benzene, in oil refineries, like for example exposure to beta naphthalene, exposure to benzene, exposure to many industrial solvents that lead to and occupational related chemical diseases. The fifth reason, the fifth source represented by exposure to ionizing radiation, where radiation disasters considered as one of the most important source of toxicity due to exposure to radioactive material and the radiation associated with the use of these radioactive material. And a good example for that is the Chernobyl disaster or Fukushima disaster in Japan, and Chernobyl, as I said before, in Ukraine. The sixth source of the toxic disaster is the consumption of alcohol and drug abuse disasters, like for example excessive consumption of ethanol, opioids, cannabinoid, or other types of drug abuse. Regarding the exposure of population to toxic chemicals, it is important to verify who is more prone to toxic insults among population. Are they the children or the adults, male or female? And based on the research data available in toxicology, children below 5 years age are more prone to toxicity because of many reasons. First, the environment surrounding the children include the area around the home, and there are many substances that can affect those children, because they do not know, they don't aware about the seriousness of exposure or the harmful effect of the exposure. Second, children are curious and investigative, and the child try to know about the things he dealt with by mostly ingestion or direct contact with them without awareness about their danger. The third reason is that many household products, many substances that we are using in our houses, like detergents and antiseptics or other chemical substances, are marketed in attractive packages. These packages attract the children to be in contact with these agents and sometimes to ingest them without awareness about their danger or their harmful effects. Additionally, the natural tendency of children to place everything into their mouth. This is the only way for the children to deal with many things in environment. That's why they are more prone to the toxic insult, as I said before, because they don't aware about whether these compounds are harmful or not. And this is considered as a serious problem for both the children and for their parents. The insidious exposure are not only the reasons behind the children being more prone to be intoxicated. Sometimes during treatment of children by taking medication in the presence of children, based on the fact that if see it, I can do it. The children watch their parents, their relatives when introducing medication, and they try to mimic what they are doing. So they may introduce by accident some certain kinds of medications or drugs that are used by adults. The sixth reason, during treatment of children or diseased children by administering improper doses or higher doses than normal to those children, this may induce an accidental poisoning with drugs that should be administered in lower doses than those given by the parents. The seventh reason is that poisons are often left in easy view and accessible to the children. Most of the parents in the house are not aware about how to store or keep the chemicals out of reach of children. So poisoning also occurs because many products are used in unvented area. And another factor that increases the toxicity is the absence of information about the constituents of many products, and this complicates the approaches available for treatment of poisoning if occurs, because the physician or the clinician in the emergency department didn't know what are the active ingredients or what are the substances including in many chemical products in the house, and that may make the procedure or processes of treatment of toxicity more complicated for the physician and the healthcare professionals that are responsible for treatment of toxicity in the emergency department. As a clinical toxicologist, the first thing that you have to learn is that how to deal with the poisoned patient presented to the emergency department. The golden standard to be followed is to treat the patient, not the poison, which means that the clinical toxicologist or the emergency physician should be aware about the patient and its vital functions before knowing exactly what is the type of poison to which he is exposed. In this regard, there are standard procedures that should be followed to provide emergency care for intoxicated people. And the critical point in this case is the evaluation and maintenance of vital signs like pulse rate, respiratory rate, blood pressure, oxygen saturation using pulse oximetry, capillary blood glucose, pain severity, and body temperature. All these vital signs should be carefully evaluated, and the normal function of the respiration, cardiovascular system, and the CNS should be controlled and maintained during treatment of acutely poisoned patient presented to the emergency department. As I said, the standard method or approaches for the assessment of poisoned patients or patients acutely intoxicated with chemical included many evaluation of many vital signs like pulse rate, respiratory rate, blood pressure, oxygen saturation, capillary blood glucose, pain severity, and body temperature. This is very important for determination of how much the toxic response is severe, and to establish a good or the right way to treat this toxic response. For example, in most of the patient, or in certain circumstances, patient is presented to the emergency department unconscious or in comatose state, in state of coma. So these can be evaluated by assessment of the loss of protective reflexes of the patient, looking for any obstruction in the airway due to a flaccid tongue, for example. Also evaluation of whether the patient aspirate its gastric content during vomiting into a tracheobronchial tree. This is very important because this may lead to suffocation of the patient. In addition to evaluation of loss of respiratory drive, to know to which extent the patient or the intoxicated subject can respirate normally or need assistance in case of a presence of respiratory arrest. And evaluating these signs and symptoms will be beneficial for the clinician to understand the nature of toxicity and to establish an evaluation method to deal with this patient. Also, we should take care about the blood pressure by watching the hypotension, which may occur due to depression of the cardiac contractility, especially after exposure to toxins that directly affecting the cardiac muscle and decrease contractility of the myocardium. Another important signs and symptoms are in shock. We should look whether the patient is shocked or not due to excessive loss of blood in cases of hemorrhage, whether it is external or internal bleeding, which may be not predicted by eye or by macroscopic examination. Sometimes the patient is present hypovolemic due to the loss of high quantity of fluids in cases of severe vomiting, severe diarrhea, or in case of vascular collapse. Sometimes we should, in certain circumstances, we should measure the body temperature and be aware about the signs and symptoms of hypothermia, which sometimes in certain circumstances worsen by administration of IV fluid rapidly at room temperature. Moreover, in certain cases there may be a cellular hypoxia in addition of or in spite of adequate ventilation and oxygen administration. But in this case, due to the presence of certain toxins like cyanide, carbon monoxide, or hydrogen sulfide, these kind of toxins interfere with the oxygen carrying capacity of the blood and lead to hypoxia and in many organs, including the brain and the kidney. The clinical toxicologist should also monitor the presence of convulsions in the form of seizure, and this convulsive condition may lead to pulmonary aspiration of fluid or asphyxia. Also, muscular hyperactivity that lead to hyperthermia, muscle breakdown, myoglobinemia, renal failure, lactic acidosis, and hyperkalemia. All these signs and symptoms may be resulted from an increase in the muscular contraction or skeletal muscle contraction due to exposure to toxin that induce contraction of muscle centrally or peripherally. In certain circumstances, the ingested toxins or the chemical substances that produce the toxic symptom may lead to behavioral changes, or what are called behavioral toxicity. Like this will lead to traumatic injury from fights, accidents, fall from high places, or due to suicidal attempts by ingestion of chemicals or drugs that affect the behavior, especially the drugs that are used for treatment of psychiatric disorder or any other CNS drugs. Furthermore, we should look for the presence of any damage, any massive or severe damage to a specific organ system, especially the respiratory system, the CNS, and the kidney. For example, the liver is highly affected by poisons or toxins like large doses of acetaminophen or exposure to amanita phalloids present in the poison mushroom. Those are considered as selectively toxic to the liver and may lead to fulminant hepatitis. The exposure to paraquat, which is a herbicide, lead to damage to the lung tissue and predisposed to respiratory problem. Domoic acid is a produce selective brain damage. Exposure to ethylene glycol will lead to selective kidney damage, while exposure to cobalt salts, for example, we should look for a massive damage in the heart. And we should realize also the time of exposure to these toxins is very important, because in certain circumstances acutely poisoned patient may die after 48 to 72 hours if not treated very well, especially depending on the dose ingested and the severity of the signs and symptoms occurred due to exposure to these toxins. One of the requirements for treating poison patient is the understand of the relationship between the dose and the toxic response, because both severity and type of toxicity are mostly correlated with the plasma level of the ingested toxin. That's why, just like what we have in pharmacology, the basis to understand the pharmacological response is to find the relation, or to study the relationship between the dose and the pharmacological activity. Similar things should be followed in toxicology, and we can, based on this fact, we can compare between the severity of toxicity or the type of the toxic response produced by different kinds of toxin. Like, for example, in this case, we have two drugs, drug 1 and drug 2, both produce different types of toxicity. Both produce sedation, anesthesia, and respiratory arrest at high doses, but they differ in the amount or in the dose required to produce each one of these signs of toxicity. And we can see drug 1 need less doses, lower doses, to produce anesthesia and sedation more than drug 2, but both of them and at the same doses produce the respiratory arrest. Good understanding of the epidemiology of poisoning is very important for the clinical toxicologist to establish treatment and the prevention program. So knowing exactly the incidence of toxicity, the rate of toxicity, what are the types of common poisons in the community, and the type of intoxication, what are the class, or what are the type of population exposed, and the terminologies related to understand these signs are very important. Regarding, as I said before, the relationship between the poisoning and the dose is very important, because variation in the doses may lead to qualitative and quantitative aspect, or differences in the qualitative and the quantitative aspects of toxicity, and this is mostly correlated with the dose. And based on this criteria, all things, or all substances, all chemical substances that we are dealt with in daily life can be potentially toxic, and the key factor in this regard was the dose. Some drugs that are considered safe may be toxic in high doses, and certain compounds may be also toxic even if they are administered in low doses. So the a critical point that governs whether the compound is highly toxic or mildly toxic is the administered dose. And it is also most important to classify the types of exposure to poisons. Sometimes the poisoning may occur due to suicide attempts, where the subject tried to kill himself by ingestion toxic material. Sometimes the exposure to toxin is accidental, and due to, for example, poor handling or bad or non-effective understanding of the type of chemical substances we dealt with. Sometimes the poisoning is deliberate, where self-harm or parasuicide was induced by the patient. Sometimes the exposure to toxin is occupational, due to occupation of workers to toxic substances during their work, like, for example, exposure to toxic gases or toxic chemicals like solvents in the industry or in the workplace. Depending on the duration of exposure to the toxin, or the time where the toxin became in contact with the biological system, we can classify the exposure to poison into whether the acute poisoning or chronic poisoning. Acute poisoning means exposure to high doses of the toxin within a short period of time. This may predispose a serious type of toxicity, and as I said before, the patient or the subject may die within 72 hours if the case is not treated properly. We have another kind of poisoning, which is a chronic type of poisoning, where the subject continuously exposed for a long period, for example for weeks, months, or even years, to small doses of toxins. And in this case, the signs and symptoms may be reflected to a serious damage that may be irreversible. Additionally, good understanding of which class of poisoning is more predominant in our community is very important. for the health care providers to establish the right way or the right plan for treatment of the expected poisoning cases. So it is important to determine the severe cases of poisoning for the health care system, because the accidental causes and the protective measures that should be established to protect the community against the toxin. Certain kind of toxicity may be associated with medication errors or mistakes in using drugs or prescribed or non-prescribed drugs, because such a type of exposure may cause morbidity and mortality in the population. Also, we should rely on the choosing a proper sources of information to improve our knowledge about the toxin. This is mostly performed by establishing what are called the poisons information centers in different healthcare settings. These centers are responsible for providing information about the common type of poisons, the common signs and symptoms associated with the exposure to these poisons, and give an idea about the how to use antidotes and how to establish procedure for treatment of poisoning. Additionally, collection of data about poisoning in these centers is very important, and make these data very well arranged and considered as a source of toxicity and poisoning for the community. This will provide all the required data for the healthcare providers to know exactly what are the common types of poisoning present in our community and how to treat them. There are many internationally established centers in this regard to provide the experience and the help for many centers worldwide, like for example international classification of diseases, diagnostic codes, the local databases in any country, which is maybe national and healthcare settings. The data link and share policies also should be followed, and this is considered as an important point for the cooperation between different countries, different healthcare settings, to provide information about the common poisons and how to treat the poisoning cases. The factors, we have multiple factors that influence the severity and type of toxicity in addition to the dose of the poison. We have an influence of the age and gender on the severity and type of poisoning, because adults respond differently from children or from old age to the effect of toxins. Sometimes there is a difference between females and males in the toxic response due to exposure. There are other important point, which is the role of local factors. Local factors mean the environment surrounding the people. This may also have an influence on the severity of the toxic response or the type of the toxic response. And additionally, the use of epidemiology data for public health gain is very important. This will lead to good education of people about how to prevent or how to protect the people against toxic exposure. And also we should have an idea about the rate of self-harm in the community, because this is very important to protect against such a type of experience. A drug abuse rate also should be evaluated in the community to protect the community against abuse of alcohol, abuse of amphetamines or another kinds of hallucinating agents. Identification of the adverse effect also is the responsibility of the healthcare system, and this is based about thorough evaluation or information from different healthcare systems to make a database that describe the most common adverse effects or events occur due to the use of drugs by people. Also, we should know something about the possible sources of contamination in our environment, and knowing exactly the sources of contamination, we can establish a preventive and protective measure. Like, for example, if the contamination in the water, we can use a more appropriate way to decontaminate water, decontaminate the soil or the air or anything we use during our daily life. Also, we should have an idea and data about the fatality rate after exposure to toxic agent. This give us an idea about to which extent the chemicals or the substances that we are daily dealt with harmful to our life. Moreover, using statistical approaches to evaluate and compare between all the available data regarding the toxicity is very important, and give us a good information about the rate of toxicity and the types of toxins, the possibility of harmful effects or the possible harms or threats to our community. All these data are should be, all these factors should be considered by the clinical toxicologist, because the clinical toxicologist is responsible for implementing the approaches for prevention, protection, and the treatment of poisoning once occurred in our community. Toxic response due to exposure to drugs or chemicals can be attributed to various mechanisms depending on the physicochemical properties of the toxic agent and the biochemical characteristics of the target cells, tissues, and organs. And anyone should be familiar, or anyone interested in toxicology should be familiar with the terms like the toxic dose and the LD50, the lethal dose of 50% exposed, which represent the basic concept required to understand the mechanisms of toxicity. The principal toxic response is based on a classical pharmacological dose-response relationship, as we mentioned before, which means that the degree of toxicity, or the severity of toxicity, the appearance of signs and symptoms, and sometimes and in certain circumstances the type of toxic response would depend about the ingested dose or administered dose of the toxic material. That's why it is very important to know how much dose or the quantity of the toxins introduced or available in the body. Moreover, metabolic and physiological responses in the different animal species examined during experiments of experimental toxicology should be resemblance of humans, because this is the only way to show the to which extent these signs of symptoms can appear after exposure of a human to these toxic response, which means that the biochemical mechanisms or the metabolic pathways in the selected animal model during toxicology experiment should be as much as related to those present in human. In practice, toxicity or the toxic response is only established or can be only established following experience in a clinical use. We cannot induce toxicity in a human because this is illegal to know exactly the toxic response or the expected toxic response after administration of toxic dose. The only information available in this regard is based on what we are found in animal experiments. But practically, we can, as I said before, establish a data based on the cases of toxicity reported in the toxicity centers or in the emergency department, and this is the only way to have an experience about the data in clinical toxicology. Regarding the time frame of poisoning or toxicity, the time since exposure to toxin and appearance of signs and symptoms is very important to be very well defined. And in most cases, the exposed subjects are presented to the emergency department after acute exposure, mostly due to appearance of abnormal signs and symptoms after ingestion or dermal contact with the chemicals that produce toxicity. And this time represents the acute poisoning case. However, mostly physicians will see patients in poisoned acutely, as I said before, because administration or ingestion of high doses of the expected toxin produce abnormal severe signs and symptoms. This will lead to taking the patient or the intoxicated subject to the emergency department. Moreover, the clinical effects of toxicity may result from repeated doses below the toxic threshold of the chemical, and due to the accumulation of these or the cumulative property of this compound, accumulation of toxic substance in the biological system may lead to what is called a chronic type of toxicity. In this case, the patient presented after a long period of exposure, and in this case there may be a fatal irreversible damage to the organs. The clinical features, accordingly, the clinical features of toxicity could be acute, subacute, chronic, and in some cases the toxicity being irreversible. That's why during evaluation of safety of compounds like drugs or chemical agents that we are consume daily were studied or evaluated toxicologically by during different phases. The acute study by studying the acute toxicity, subacute toxicity, chronic toxicity, and to know exactly the doses and the time required to produce such a type of toxicity. For good understanding of poisons or chemicals that may be unexpected poisons or expected toxins, we should have an idea about how to classify these agents and the basis used for classification. So toxins or poisons can be classified based on many features, like for example their origins, whether they are originated from, whether they are synthetic or natural, obtained from animals or plants origin or from microorganisms. The chemical structure sometimes is used to classify the toxin based on the presence of certain chromophores like phenols, aldehydes, or acids. The modes or the pattern of action or the biological action produced after exposure, like for example cardiac toxin, nephrotoxin, hepatotoxins or CNS toxins, etc. And the target organs and the mode of action, whether they interact with enzymes and produce enzyme inhibition or enzyme induction, and so on. Sometimes the classification is based upon the form of these chemicals, or like for example pharmaceutical agents, household products that are used in like cleansing agents or in antiseptics, the pesticides, sometimes the chemicals that are used for eradication of insects, solvents, which are chemicals used in industry for during synthesis of chemical or preparation or formulation of certain material. Snake or other bite, when the toxin is obtained from animal like snake or scorpion, etc. Some of poisons are plants and the plant product. The plant itself as a whole may be toxic, considered as a toxic agent, or sometimes products that are obtained from natural plant or from plant sources are considered as toxin. In certain circumstances, the classification is based on the site of the poisoning. For example, home poisons, any substance that are used during daily life in our houses. Sometimes the toxins belongs to the garden, where the chemicals that are used for as a herbicides or fumigants, or sometimes isolated from the plants, etc. The workplace, like in oil refineries, in industries of that use chemical substances, in the school, where some facilities or things are used during the activities in the school. Toxicity due to substances used in hospitals or medical facility, whether they are biological or chemical agents. Sometimes the classification is based on the presence of chemicals outdoors, which means in the street or anywhere outside the home. This approach may be useful. The approach based on the site of poisoning may be useful when considering likely dose or designing and applying preventive measures to avoid exposure to such a type of toxins. Now, what are the mechanisms through which the toxicity produced by a chemical? Chemicals, just like what we see in pharmacology, or when we study the pharmacological effects of drugs on the biological system, in case of the mechanisms involved during toxicity is a little bit similar to what we have in pharmacology, but the difference is in the dose. So the toxicity produced by chemicals are mostly related to the mode of action of the expected toxins. For example, some of them produce a local direct effect to any kind of tissue exposed to this toxin, like for example exposure to caustic material in the form of acids, strong acids or strong alkalis. This will lead to non-specific tissue damage. They can damage any kind of tissue they exposed to, whether the skin, soft tissue or mucous membranes, etc. Some toxins are produce their toxicity by damaging the lipid membrane, like the organic solvents. The organic solvents disturb the lipoidal structure of the plasma membrane, and this will lead to disturb the balance of ions across these plasma membrane and lead to edema or in certain cases rupture of the cell and death. And certain kinds of toxins interact with specific receptors of or ion channels. These represent all the drugs that act through receptors. For example, beta blockers or muscarinic blocker or agonist or antagonist. The toxicity is based on exaggerated effect due to interaction of high doses or high level of these chemicals with their specific, sometimes selective receptors in the biological system. Like for example, due to atropine, due to excessive blockade of all muscarinic receptor in the body, or toxicity with acetylcholine esterase inhibitors, where blocking the hydrolysis of acetylcholine will lead to exaggerated cholinergic response that predispose to toxicity. Certain kinds of toxin are considered as a metabolic poisons on many enzymatic systems, like compounds that interfere with the Krebs cycle or interfere with the electron transport system in the mitochondria. We have other kinds of toxins or substances which are by their cells are not toxic as such. Like for example, paracetamol. Paracetamol is a non-toxic material, but as a result of its biotransformation in the liver, it will produce a toxic metabolite, and the toxicity or the toxic response was attributed to the effect of these toxic metabolites. Certain kinds of toxins are also considered as mutagens or carcinogens, and exposure, long-term exposure to these agents may predispose to malignant changes and production of different types of tumors. Moreover, in certain cases, certain chemical agents may act as cytotoxics, primarily damaging rapidly dividing cell in the gut or in the bone marrow, like the drugs that are used in the chemotherapy of cancer. Sometimes the toxin produce damage to cell organelles, like mitochondrial damaging to mitochondria, where we have certain compounds that are selectively mitochondrial toxins like carbon monoxide, for example. Sometimes the poison or the toxin trigger secondary biochemical processes, like for example the snake venom. The snake venom introduced an antigen-antibody reaction, which are secondary biochemical processes that lead to anaphylactic reaction and death due to such a kind of effect. Moreover, teratogens or teratogenic chemicals cause damage to the developing embryo. That's why they are called embryotoxins. We have many kinds of toxins specifically act on the embryo and produce teratogenic effect. For example, like the thalidomide. Sometimes the toxin or the toxic insult was attributed to ionizing exposure to ionizing radiation produced by different kinds of radioisotopes that are used in industry or for the diagnosis of disease or for the treatment of certain diseases. This will cause direct cell damage that may lead to cell death if the damage is not regenerated. In pharmacology, the dose-response relationship is clear, which means the relationship between the amount administered and the amount of response produced is quite clear and can be easily predicted, because we gradually increasing the dose until we reach to the maximum response. However, in case of poisoning or in poisoned patient, clear differentials in biological response are rarely seen, because in this case we have an overdose of the drug which exceeds the maximum therapeutic response produced, and this can be attributed to that most drugs in high doses cause a complex pathophysiological changes, where the high blood level or high plasma level of these drugs may produce pathological changes in many organs and cells other than targeted by this agent. Additionally, such a kind of doses acting on more than one receptor site or target, which means that the selectivity of this drug will be terminated or will be abolished, and the high availability of or high concentration in the plasma will lead to target more than one receptor in different target tissue or organs, and this will lead to generate or initiate toxic response or adverse effects or toxic response. Also, the importance of secondary pharmacology becomes very relevant because we have some drugs or some therapeutic agents that have different kind of pharmacological effects depending on the type of the dose. For example, antihistamines in low doses did not produce CNS depression, but when used in high doses, they may induce hypnosis or sedation, and in higher doses they may lead to CNS depression that may predispose to respiratory arrest and death of the subject. That's why the dose response during toxicity is very hard to be clear due to the complex biochemical changes or complex pathophysiology produced during exposure to high doses. In addition to synthetic chemicals that are widely used by or consumed by humans, toxic compounds may include chemicals that may be obtained from biological sources, including toxins isolated from bacteria, from animals like snake or scorpion, and from plant sources like amanita, like for example strychnine or picotoxin. Some of these agents are extremely receptor specific, like botulin toxin obtained from fungus from botulism. This drug is extremely specific that target the process of synthesis of acetylcholine or interfere with the synthesis of acetylcholine. Certain kinds of these toxins may act on cellular mechanism to cause cell death, like the ricin obtained from the castor oil plant, or the alpha-amantine obtained from or produced by the toxic mushroom Amanita phalloid species. Moreover, snake venom acts on several targets in the body after exposure to snake venom and may produce local and systemic inflammatory response that may lead to death due to severe anaphylaxis. As I said before, the toxic response is a multifactorial phenomena, and the type and severity of the response, there are many factors that influence the appearance of toxicity. Some patients, for example, have symptoms of toxicity that are not easy to explain using conventional toxicological assessments, as we mentioned before. This may be attributed to certain abnormality in the biochemical mechanisms within those patients, and mostly these are related to differences in genetic differences that predispose to differences in the enzymes or targets or sometimes receptors. So the effect of toxin on those subjects cannot be explained or not very easily explained based on our conventional toxicological knowledge, how to assess the patient and attribute the signs and symptoms to certain causes. Moreover, the toxicity or after exposure to the poisoning agent or toxic chemical may occur at a concentrations of chemicals that would not be expected to cause conventional toxicity. For example, we have a chemical substance expected to produce toxicity in human at a dose of that exceed 100 milligram when ingested by subjects, but certain subjects may show the toxicity even when exposed to 20 or 25 milligram of the substance, which means quarter or below quarter of the expected dose. This is called maybe called as idiosyncratic type of reactions due to certain characteristics of the biological system of those patients. Sometimes the toxicities was reflected as immunological responses, which play a role in occupational asthma and dermal toxicity due to exposure to biological material present in the atmosphere. This is considered an uncommon type of toxicity and not due to direct effect of the chemical substance of the or a certain toxin. Based on the previously mentioned principles, this figure demonstrates the relationship between various terms and activities related to the clinical aspects of toxicity and the task of risk assessment duty that should be conducted by the clinical toxicologist, and which determine its responsibility to protect community against the expected toxic exposures and implementing treatment measures in different occasions. So hazard identification, for example, to answer the questions what toxicants are involved during toxicity, what are the physicochemical properties of each expected toxin, and what are the toxicokinetic and toxicodynamic properties of each expected toxin. This enables identification of hazard that may be produced by these agents. Another important activity is to characterize the relationship between the dose and the toxic response, and to answer the question, do toxic effects exhibit a dose-dependent relationship or not, which means that is the toxicity gradually, or the toxic severity of toxicity can be gradually correlated with the differences in the dose or not, and what are the clinical plasma concentrations required to produce this toxicity. This is mostly based upon evaluation or assessment of the amount of the toxin in the plasma, and try to correlate this amount with the severity of the response. The third is the assessment of the clinical status of the patient. The clinical status may suggest identity of the toxicant, which means from the signs and symptoms we can predict the type of the toxin, or may suggest extent and time of exposure depending on certain information provided by the patient or predicted during clinical evaluation. And also the signs, the clinical status of the poisoned patient may suggest the treatment strategy based on the type and severity of symptom. Also, exposure to the toxin is evaluating the way of exposure to the toxin is very important. What was the extent of exposure, how much the patient ingest, or how much of fluid in contact with, being in contact with the skin, or etc. What was the route of exposure? This is through the skin, through inhalation, and that may affect the lung, or through oral ingestion. And the time since exposure. This is very important because it plays an important role in determining the approach how to treat the patient. And the identification of the patient characteristics like genetic background, pre-existing conditions, if the patient has a disease or disorders, and the type of treatment used for this condition, the anthropomorphic characteristics like the weight of the patient, because it's important to determine the toxicokinetics of the toxin. All these information are critical or very important for the purpose of assessment of the risk, or risk assessment, which is the important job of the clinical toxicologists or the authority responsible for protecting the community and preventing the possibility of toxicity due to exposure to many toxicities. In the other word, this is very important as a toxicologist responsibility, or responsibility or of subjects that are specialized or working in the field of clinical toxicology. Thank you.